Hi, my name is Dr. Bill Owens, and thank you very much for taking the time to listen to this short video. I wanted to take a moment to discuss how important chiropractic research is in building your practice for the short term and for the long term. Right now, we have two states in the country, New Jersey and Texas, that have implemented legislative change. So they've done this legislatively to, in effect, only authorize treatment that's considered evidence-based. And what that means is there evidence published to support what you're doing? And remember, evidence-based care is based on three things: published research, the doctor's clinical experience, and the patient's response to care. What I want to talk about just for a minute here is the research side. The amount of research that's coming out on chiropractic care is coming faster, and it's more detailed than it's ever been before. The problem is, in order for you to build your practice, you have to be able to communicate that with the medical profession. Now, understand that a medical doctor will not use nor will they refer for a procedure that is considered experimental. And what experimental means is that there is no published research that it's effective. We've all seen different guidelines that have used the experimental thing as a way to deny care. But the truth is, most of those things, most of those items aren't researched. There's procedures that come out ahead of the research. So if you're looking at other techniques and other procedures, the first thing you should ask is, do you have any evidence published? Somebody that has a technique or a new procedure should have taken and had the foresight to have taken the effort and put the effort up front to be able to publish some research. But that's an aside. What I do in my private offices and what I've done in the hospital clinics that I started, and what has gotten me my adjunct position at University of Buffalo Medical School, is sharing chiropractic research and being a resource for that. Once you're able to take the chiropractic research and show how effective your care is to the medical profession, you become a resource for care. And you become a resource for care for two reasons. One is that you are no longer, in their eyes, experimental. And two, you offer a solution that nobody else offers. That's the secret. And it's so simple that most chiropractors across the country fail to see it. And when they start to see it, it takes us a little while to get it. You know, it took me a while to understand how to put the research together and how to speak in short sound bites. It also took me a while to understand how we can use this research in our reporting. And you'll see another series of videos specifically on EMR macros. But always remember that a medical doctor cannot refer for a procedure that is considered experimental, no matter how much clinical success or evidence in your own office there is. And that is one of the things that the chiropractic profession has relied on for 116 years. But the difference now is, if you can take that research and educate the medical profession, the game's really over. You will be inserted into that system and you'll be busier than you ever imagined. So just in kind of summarizing to follow up here, there's three ways that we use this research. One, or three ways that we would build you to use this research, I guess, is probably the best way to talk about it. The first way is that we need to get you credentialed and your curriculum vitae up to par, because that's what the medical profession looks at first. Basically, after school, did you go through any training that really has any sort of merit to it? And that is advanced imaging, that's diagnosis, all that good stuff. Secondly, is we want to be able to teach you how to use the right research in a way that the medical profession will understand, and to do that on a regular basis. And lastly, third, is the ability for you to present these topics in a formal continuing medical education scenario. Those are lunch and learns, those are breakfasts. They're generally short, small group sort of scenarios. But with the continuing medical education, your credibility is instantly elevated to peer level. So those are the three pillars, and that's what I teach, that's what I do for myself, and that's how I market my practices. So remember, research is critical because it shows that what you're doing is not experimental. And once you can show that you're not experimental anymore, then the floodgates will open and you will become a resource and you'll have more referrals than you could ever gain from doing paper advertisements, websites, search engine optimization, health fairs, patient and family talks and presentations, and just being out trying to pander for patients. Working with the medical community within the scope of what chiropractic can offer is the most important step you can take to protect you and your practice in the short term and the long term. So my email address and phone number are right on the screen. If you'd like to talk to me, I'd be more than happy to. I discuss these topics with people across the country on a daily basis. The easiest way to get a hold of me is through email, but I look forward to having some conversations with you and to see where I can help you the most. Thank you.